Hi, I'm Nick. I'm 14 years old, and today I'm going to be interviewing Professor Andrew Steer. Hi, Dad.
Hi, Nick.
Can you tell me about your work in global child health?
So I'm very lucky here at the Murdoch Children's Research Institute to work with a whole bunch of global health researchers. We've got an amazing array of people that work in global health, and we work in about 25 countries, particularly in our region, so neighbouring countries. And we do work in vaccine research, we do work in infectious diseases like TB, rheumatic heart disease, scabies and other neglected tropical diseases. And we also do some great work where we train local doctors, nurses and local researchers about how to be the best they possibly can. And it's a really rewarding field to work in. I feel really lucky.
So what are you working on at the moment?
I have been called the scabies guy, and I'm owning that. So scabies is this mite that burrows under the skin, and it's really common in many Pacific Island countries. Like for guys your age, maybe 1 in 3 students at school would have scabies. And it's a really horrible, itchy disease that can lead to other complications. And we now have the World Scabies Program, which is rolling out community-wide treatment in both Fiji and Solomon Islands. And we're hoping to expand that approach to a number of other countries as well. And I'm super excited about it because it's a really simple program that's really effective, and we're looking forward to seeing how the program rolls out over the next couple of years.
What are you working on next?
What's next for me? I'm really passionate now about not only my own research, but the research being done in global health across the Murdoch Children's Research Institute. So working with my colleagues around new vaccines, particularly for a bacteria called Strep A, working on strengthening our partnerships with a number of different countries, improving clinical care, including research activities across the Pacific. We're really excited about that. I think it's a really exciting time for us here at the Institute, and I feel like we're going to take it to the next level in what we can do.
That's amazing. Thank you, Professor.
Thanks, Nick.
So my son Nick is mortally embarrassed by that video. So if you see him, just tell him he was amazing and he should pursue a career in acting and go to Hollywood. So I am really pleased to be able to be here with you all today. It's amazing to see so many people in the room, and I'm going to be talking to you about infection, immunity and global health. And I wanted to start by just acknowledging the elephant in the room, which is the length of the name of our theme. And I actually think it's really important that we have global health in our theme name. I feel really proud that MCRI has a focus on global health. I want to just say that global health is not just in our theme. Global health is everybody's business at MCRI. And I also want to acknowledge that we have Melbourne Children's Global Health, which is a campus-wide initiative, a partnership between MCRI, the university and the hospital, which takes a really broad view. And there'll be people in the room here that do global health research that are not in our theme, but it's all really important work. So with that, our vision is to improve the health and well-being of all children by better understanding infection and immunity. And we do that through key partnerships. And we really sit at the nexus between infection and the body's response, whether it's an immune response or inflammation or tied together, with a focus around the globe and the issues that affect children the most around the globe. So I'm going to talk about the what, the why, the where, and the how, and a little bit about the future. So the why do we do this work? Well, infectious diseases are still the major killer of children under 5 around the world. And that's largely due to pneumonia, diarrheal disease, malaria, TB, HIV, and others. So in 1991, there were 13 million children who died under the age of 5. And we've made amazing progress. We're now down to around 6 million. But that's 6 million children who still die prematurely. So globally, infectious diseases are a huge issue. And then locally, and this is an article in the Lancet Regional Health Western Pacific region recently, over 50% of admissions to paediatric hospitals in Australia are as a result of infection. So infectious disease still remains a super important reason for children to get sick, come to hospital, and sadly die. So that's the why. And then there's the who. And so we have 20 groups in our research theme, all amazing people as group leaders and team leaders, as you can see here, but equally amazing people that work within all of the groups. I'd really like to have a shout out to the postdocs, the PhD students, the research assistants and the support staff. We're so blessed to have such amazing people working in the theme. Our work focuses on global health, immunology, inflammation, allergy, vaccinology, and clinical infectious diseases. Some of us work across all of those areas, some of us work across particular aspects of that. But there are 5 key research areas. And so the how. So there's the science, right? There's the pathogen or the allergen and the immune response, whether it's T cells, B cells, humoral immunity, cellular immunity, all the aspects of the immune system. And understanding that relationship between the pathogen or the allergen and the immune system is at the nexus of many of our researchers. And we do that through disease models, whether it's in vitro, in vivo, or humans, mice, lambs, or organoids, as we're going to hear about soon. Really with a focus towards clinical studies and the developments of vaccines, treatments, and diagnostics. And we're going to hear from Amanda Gui soon about antimicrobials and the threat of antimicrobial resistance and what we can do about that. And then all of our work really pushes across this side, which is to translating all of that research into policy and practice, whether it's clinical guidelines or public health policy at the WHO level or other levels. And I must say that as a research institute, as a research theme, we really punch above our weight in terms of our leadership and representation on global international leadership boards. The other part of the how is our partnerships. So we have key partnerships with international organisations like the WHO, with the Department of Foreign Affairs and Trade in Australia, with UNICEF and others. And then we partnership locally with institutes and universities in Victoria and Australia. We also partner with our funders, and we can see some key funders on the screen there. But what's most important, and we're going to touch on this during our panel discussion, is our partnerships in the region. So we really have quite an amazing array of collaborators right across the world, and you can see our global footprint. And this kind of changes week by week with new collaborations and projects that start. But you can see particularly that we sit in Melbourne and we have a view to the Asia Pacific, and we have quite remarkable partnerships and collaborations with local ministries of health, with universities and other academic institutions right across the Asia Pacific region, particularly in countries like Fiji, Solomon Islands, Vietnam, Indonesia, Laos. And some of those partnerships go back 30 or 40 years, and they're very trusted and important relationships. So the other part of the how is a few examples. So I've just got 4 little examples up here. When I say little, they're not actually that little, they're pretty major. And I'm just going to use each of those to sort of talk about the ways in which we work. So the first is around pneumonia, the #1 cause of child mortality across the globe. And pneumonia is up there because we really work across the breadth of discovery, clinical trials, right through to policy. And I've highlighted Fiona Russell's Centre of Research Excellence for Pneumococcal Disease, because that's really been leading the way across the region in prevention of pneumonia. And then you can see also the rotavirus vaccine. As many of you know, rotavirus was discovered here by Ruth Bishop in 1973, so some time ago now, and 50, thank you. I was doing the maths in my head and I wasn't quite computing. So 50 years ago, and it's an amazing legacy from Ruth and the team, Graham Barnes and Julie Bynes, who've then been able to spin that discovery out into a vaccine that's going to be licensed and in widespread use in Indonesia and hopefully other countries. Then there's oxygen supply, and the reason the oxygen supply is up here is really around our ability to take on global leadership and innovate. So this year there was a World Health Assembly on oxygen supply, really bringing to the world's attention that oxygen is a drug that we all need, and most people in the world don't have access to it. So the work through Trevor Duke and Hamish Graham and others really supported that World Health Assembly resolution, which was successful. And then finally, our COVID-19 research, and I popped this up here because it really speaks to the collaboration that has been so successful, I think, around COVID-19 across the whole of the Institute, particularly between infection immunity, global health, population health, but then right into clinical sciences, genomics, and stem cell medicine. It was amazing to see the whole Institute pull together around one issue. So the future, and we're going to have a panel discussion on this. We've got some real experts who are going to come up on stage and have a discussion. But in the middle of the future are the Sustainable Development Goals. And I'll be walking around at lunchtime, and I'll be asking each of you to name one of the 17 Sustainable Development Goals, so be ready for that. So there's this great framework for how to move ahead with sustainable development, but you can see here that there are a series of threats and opportunities towards those sustainable development goals, whether it's climate and geopolitical change, new existing or emerging pathogens, COVID-19 and what comes after that, and the importance of AMR, which is antimicrobial resistance. Then there's the changing digital world. I think there are 3 times as many mobile phones in the world as there are toilets, which speaks to access, what's important for us to access, perhaps. And then there's the opportunities around new vaccines and therapeutics, and really what we can do at MCRI to drive those forward. So, with that in mind, we're going to have 2 sets of speakers talk to us about their work. So it's time for a bit of science and some science presentation, and I'm absolutely delighted to introduce Amanda Gui, who's a newly minted group leader within the theme, who's going to be talking to us on utilising antimicrobials better. Thank you.